Hello, my name is Priyanka. I'm 20 years old. I'm from California. I have vitiligo and I was diagnosed when I was 12, so I've been living with it for the past 8 years. So I think it took about a year to get a formal diagnosis. When I was younger, I had a history of eczema and also pityriasis alba, which is commonly confused with vitiligo. When I went to a doctor again, they tended to look at those options as opposed to vitiligo. The first specialist that I went to who gave me that answer, my mom wasn't satisfied with. She knew that it was something more than that. And so she just decided to go to more and more specialists. I think we probably saw three before I got an official diagnosis, which was a shame because by then the vitiligo had spread just from the corner of my mouth to like the entirety of my jawline and my neck, my back, my shoulders, my chest. So it spread pretty quickly. And I feel that if we had been able to get that diagnosis and start hitting the spots with treatment, I would have been able to have better treatment outcomes. So that was probably the biggest difficulty in hindsight, just not getting access to treatment as quickly as I could. I think I felt a lot of different emotions. Obviously, you feel the relief from finally getting answers as to what this thing is, but there's also a lot of uncertainty, right? There's no cure for it. I mean, there still is no cure for it. 8 years ago when I was diagnosed, there was no cure. There were only treatments, and nobody in my family had vitiligo, so it was very difficult to know exactly what we were getting into. For a lot of patients with vitiligo who have a family member, at least, they have someone that they can talk to. Not that it makes it, easy on them. It's just, it's nice to have somebody that you could maybe connect to. But nobody in my family had it. Nobody really knew what was going on. And to hear that there wasn't a cure for it just added even more anxiety. So I think initially when I was a kid, I didn't mind it a whole lot. I went to a pretty small middle school, and so people didn't really ask questions. If the younger kids asked questions, then my friends would kind of just, leave her alone, don't talk to her. But as I got to high school, thankfully I never experienced any bullying, but you're kind of just at that point where you're growing into yourself. And already if you're any different, that's setting you apart. And then if you have a specific difference that's, not as normal, and that can kind of make you feel isolated. And so when I was younger, when I was in middle school, I didn't really have that much of a problem with my own skin. It was more so my family that was a little bit more worried. But as I went to high school, it's kind of when I started feeling a lot of that anxiety and social isolation. Definitely my personality back then was quite different from what it is now post-treatment. So that's kind of how my mindset changed over the years from diagnosis until treatment. So the treatments that I experienced ranged from topicals to phototherapy to punch grafting to something called NCES grafting, non-cultured epidermal suspension grafting. And so that was sort of a new technique that was being used. But the problem with segmental vitiligo is that it's typically seen as harder to treat than non-segmental vitiligo. And so because I had started so late with treatments and the disease had spread, it was very difficult for me to see repigmentation with topicals or with phototherapy. And after a couple of years of phototherapy, I stopped. There was no point in me doing it anymore. And so once my disease activity sort of stabilized, we kind of moved to mini punch grafting, where they would just take grafts from my hip, so kind of normal colored skin, and grafted onto my vitiligo areas, small dots. That was really where I saw a lot of progress in terms of repigmentation. I mean, my face is almost completely repigmented. I'd say like maybe 5% of the original white areas on my face have been filled in. Punch grafting is still something that not a lot of vitiligo patients have access to, so I'm extremely grateful that I've been able to experience that. But I went through several rounds of it. The first round was just a little bit of a test round to see that my body wouldn't reject the grafts. After that, we were able to do a couple more rounds and gain some pigmentation. I was also using phototherapy after my punch grafting. I was supposed to use it in tandem in order to promote the melanocyte growth. That was quite helpful. And then we decided to try NCES grafting. It's a little bit more complicated than punch grafting. You essentially hook up a blister machine to healthy colored skin, and you create blisters, take the tops off of those blisters, kind of use the fluid in order to create this solution that you can transfer onto the vitiligo skin, which is first lasered off, and then the melanocytes kind of just from that suspension are transferred onto your vitiligo skin. That was particularly rough. It was definitely sort of a new procedure at the time, and I was the first one at the hospital who was getting it done. So I was sort of like the little guinea pig It was quite painful, actually. We were supposed to use anesthesia. I mean, even for punch grafting, local anesthesia, but the anesthesia just kept wearing off because it was quite a long procedure, and I could feel like everything that was happening to me, like the laser just burning my skin. And at a certain point, they kept asking me, "Do you want more anesthesia?" And I remember just thinking, if they stop and inject with more anesthesia, it's going to take longer to get this over with. I just want to get this over with. And I just decided to not have anything and just feel everything that was happening. That's probably the worst pain I've ever been in, like my entire life. I would say I have a pretty high pain tolerance, but I remember my doctor asking me on a scale from 1 to 10, how's your pain level? And I said 10. And he was like, oh my God, I'm killing you. But it was definitely very tough to go through that as a teenager. I was really young back then, and I was scared, quite frankly. Even with the punch grafting, I had to get so many shots of like local anesthesia, both in the donor side and the vitiligo on my face. And the neck especially is quite vascular. So once you're injected, there's a lot of blood that kind of comes out of these injection sites. So I remember being awake for this entire thing, and they're applying gauze to my face and it's all bloody. And it's a little traumatizing. I don't, at the risk of sounding too dramatic, I just don't want to minimize how I felt in that situation. But I remember each time I would go in for punch grafting, I would anticipate kind of those shots, however, it felt like 30 or 40 of them just being injected. And I remember one time shaking, just shaking in the chair because I was just so scared of having that pain. So it was definitely mentally very tough. The recovery for both of those surgical procedures was not too bad. You're not supposed to move around a lot because gravity can pull the grafts down and things like that. So recovery was a little bit rough, but mostly it was fine. One thing that I forgot to mention about phototherapy was that I burned quite badly. I mean, burning's pretty natural when you're doing phototherapy, the excimer laser. I would have blisters constantly. There was a blister that lasted for, I don't know, 1 or 2 weeks. It was quite bad. There was one right smack in the middle of my chin. It was very embarrassing, and I had to go to school with it and have people ask me questions. It was definitely very, very difficult for me. And I remember as a kid, this is awful, and I probably only did this once, but I hated phototherapy so much that I put sunscreen on before my treatment so that the laser wouldn't burn my skin. And then I remember feeling bad after that. So I never did that again. It was quite painful. And so I'm glad that the surgical options worked out well for me. I think ultimately the results that I got from the surgery were quite impressive. I mean, if you see me without makeup, you can definitely tell that there's something going on with my skin. For the most part, it's filled in. I'd say maybe 5% of it is left a little bit white. It's sort of these like brown little islands, and then kind of in between is the lighter skin. So yeah, I would do it all again, but I think if I could have changed something, it probably would have been being diagnosed sooner, so that maybe I could have had better results with the phototherapy. But I've had an amazing team of like dermatologists, physicians, honestly, people here at IDEOM who have been constantly telling me about new treatments, and honestly also at different derm conferences, just learning about new medications. The only I guess downside to having segmental vitiligo is just not being included as much in clinical trials. I just think that more medicines are kind of geared towards non-segmental vitiligo. So I think one of the biggest challenges of having vitiligo is that people tend to see it as not as bad because it's seen as the kind of sort of a cosmetic difference. I can tell you that just when you look at treatments and you can see how much I was physically affected, it also understandably affected my social life, right? Like obviously I have this side of feeling emotionally isolated and anxious and depressed, but because of the blisters that I was having on my face and my neck, I couldn't play violin. I used to play violin when I was a kid. How are you going to play violin when you have blisters all over there? So it affected my school activities. There were times where I would show up to orchestra and just kind of imaginary play because I couldn't actually play on my real violin. And it was embarrassing to have to tell my instructors, I can't do this right now. Definitely limited me. So I think it's important for people to kind of look at vitiligo as not just a cosmetic disease, but as something that can have serious physical implications from treatments, as well as serious emotional burden. And not only that, the financial burden as well. Because I did treatments for so many years, and at the time, Opzelura wasn't approved. So we were having it compounded. And having it compounded just for like a small tube was at the time several $100s. The financial burden of treatments is just so large. And I think it definitely affected my family functioning as well. Just constantly have to deal with medical bills and doctor visits and the worry of not knowing when this is going to spread even more, if my whole, body was going to turn white at a certain point. And I think that worry is sort of still there. I mean, I worry about starting a family in the future and getting pregnant and that causing a flare up. I've made so much progress with repigmentation that if that were to happen, I'd probably feel devastated. I also think that having vitiligo, not being born with vitiligo, so developing it when I was 11 or 12 and being diagnosed, it's really difficult to deal with the before and the after, right? I know what it's like to look normal, and to see how people's views of me shifted so dramatically was so telling. I remember when I was younger comparing myself to, or seeing myself in a lot of ugly characters in Disney movies that would sort of hide themselves away, like the Hunchback of Notre Dame. That was like the real one that I really identified with, because people just looked at him a certain way and people looked at me the same way, with like disgust and fear. And a lot of times they didn't even want to have a conversation about it, right? They just had their own opinions. And it was so strange to go from like being loved on and praised for doing well in school and being social to just cut off from normal people. Definitely tough, but I think becoming part of advocacy groups and IDEOM and getting involved in policy and talking to the FDA has really shaped my journey and my personal acceptance. So it's been hard, but I think the journey has taught me a lot about myself, how to treat other people, and it's also ignited my passion for pediatric dermatology. That's what I want to do in the future. I first heard of IDEOM through the support group that I'm a part of. It's called Vit Friends. And the founder of Vit Friends told me about IDEOM and about how IDEOM had been trying to reach out to patients who wanted to talk about their journey. By this time, I had participated in the FDA's patient-focused drug development meeting for vitiligo. It was the first meeting that they had, where they basically just, kind of similar to this, invited a lot of patients, stakeholders, caregivers to see what exactly do vitiligo patients want in a drug. And so I was able to present on that and kind of gain a little bit of experience with public speaking and sharing my story. I was very shy, painfully shy. And my first year when I came here, I believe it was 2021, the same year that I presented at the FDA meeting, I struggled to get up there and tell my story, and I was 16 at the time, so quite young, and there weren't a lot of people who were the same age as me. And I think the biggest thing that I struggled with was knowing if people really cared about what I wanted to say. I was in a room with people who were a million times smarter than me, had several more degrees than me. I hadn't even finished high school. But instantly when I walked in, everyone was so kind. Like, that was the main thing I noticed. Everyone was so kind and supportive. I mean, all of the physicians, they would cling on to the words that I was saying, right? They wanted to hear what I had to say. They wanted to hear how they could improve. And I instantly knew, like, this is a good space. Like, this is a space that is really patient-centric and is really focused on making a difference in people's lives. And I think, honestly, IDEOM has done so much for me, more in terms of having me be involved in advocacy and giving back to my community and, the dermatology community. But it's really furthered my interest in pediatric dermatology. I mean, I've been able to collaborate on research with other physicians and other dermatologic disorders. For this past summer, I just worked on cutaneous T-cell lymphoma research, because physicians are just so kind. They know that I'm pre-med and they know that I'm interested in derm, and they've seen me present at past meetings as part of a patient panel or just presenting work group findings. In that way, IDEOM has just helped me career-wise and just expanding my research interests and honing those research skills that will make me a better physician in the future. And I've gained so many connections, just not only friends, but also medical students. And I mean, I presented my first poster this year, which was super cool. So I'm very grateful for all the opportunities that I've been given over the past 4 years that I've been here. I think my goals as a patient research partner would just to contribute as much as I can to the outcome measures that we're making. I think that we made a lot of progress in the vitiligo work group this year, which was really encouraging. And so I'm really excited for next year and all the stuff that we're going to be doing over the coming year in the meantime. So just contributing as much as possible, and honestly, probably trying to extend IDEOM's reach as well, just telling other vitiligo patients in my support group, hey, there's this really cool organization that makes open source outcome measures. Should definitely join, tell your story. We need more vitiligo patients. I think there were only 3 this year, so the more the merrier. Probably increase the diversity of opinions within the vitiligo work group. And goals for IDEOM, I mean, IDEOM's already done so many amazing things, and I mean that genuinely. I honestly think IDEOM probably has that same goal that I do, to just expand more, to be able to include more patient voices and perspectives, and to just keep pushing out those outcome measures that can continue to make a real clinical impact on people's lives. And I think, quite frankly, it's been doing that already. I mean, we saw a lot of quite emotional testimonials this year. We can definitely see the impact that IDEOM is having on people's lives. I'm honestly just really grateful to have the opportunity to come here and tell my story. I'm very grateful that physicians are so interested in what I have to say still after 4 years of coming here. I'm excited to see what we do in the future. I'm excited to see how we expand globally as well. We've already started including people from so many different countries. I'm just excited to see everything that we're going to do in the coming years. Excited to make more connections, and yeah, again, really just grateful to be here.